Give it one more minute. Okay, so hello, anti-tobacco colleagues, and allow me on behalf of the Eastern Mediterranean Public Health Network, EMFINET, and our partners from Vital Strategies and the CDC to welcome you all to our United Against Tobacco and COVID webinar. I'm Randa Saad. I'm a technical specialist with EMFINET, and I'm really delighted to be facilitating today's webinar. Last year, we hosted 5 sessions, 5 webinars on various topics related to utilizing media in our fight against the tobacco epidemic. And we've received so much positive feedback of how beneficial these sessions were. And so accordingly, we decided to continue on with this capacity building activity. And actually, this time, open it up a bit more to public health enthusiasts and specialists and tobacco advocates and civil societies from this region. Today, we have experts from Vital Strategies who will discuss with us how we can leverage best practices, including the use of a change model, the Aspire model, the use of monitoring and social media to advance a campaign's policy and to gather public support to advocate for, let's say, better and healthier tobacco control policies. I will ask you to kindly keep yourself muted. If you have any question, you can type it into the chat box at the bottom, but we will have a Q&A session after each of our presenters. If you prefer to type your question in Arabic, please feel free. I'll translate it to our speakers. And we're going to have a 5-minute break after the first hour. I'll move it on without further ado to my colleague, Rebecca Pearl from Vital. Rebecca.
Thank you, Rhonda. Hello, everyone, and welcome. I'm Rebecca Pearl. I'm a vice president at Vital Strategies, and I just want to welcome you to this webinar. As Rhonda says, we're kicking off phase 2 of our work in the Eastern Mediterranean region on tobacco control with our partners, EMFINET and the US CDC. Last year, as part of our partnership for United Against Tobacco and COVID, a communications campaign was born out of a moment of recognition that tobacco causes more severe COVID and hence more unnecessary and early deaths, which we all seek to avoid. And though COVID has come more into the background, and we hope it will stay there, tobacco remains a huge problem. As part of this project, we did a series of webinars, as Rhonda mentioned, last year, and I was wondering if any of you were involved in those webinars last year. Could you raise your hand if maybe you were involved in any of those webinars last year? Do I see any hands raised? Anyone from last year involved in last year's webinar?
I see a few names at least that were with us last year.
Yep, yes, okay. So just curious about that. So this year, our focus is not only on tobacco harms, but using the illustration of those harms to support and encourage policies that will protect people from tobacco, such as smoke-free places. And our evaluation showed that there is much support for this measure from the public and from stakeholders related to the work we've done last year. Smoke-free schools, mosques, and health centers are a popular idea, and we want to take advantage of that to encourage smoke-free policies where we can. Smoke-free policies encourage less smoking. They protect women and children from secondhand smoke, which cause 1 million deaths each year. That's people who don't smoke, but are just exposed to it. And these campaigns can also just begin to change norms around smoking too. So I've been working in partnership with NGOs and governments for more than 15 years, and I just want to say that this partnership has been a glorious one, and I hope you'll benefit from it, as I have. So we're going to talk today, as Rhonda mentioned, offering technical assistance, capacity building. You're going to hear from some of our experts at Vital Strategies on policy advocacy and communications. By the way, Vital Strategies is an international public health organization, and we work for a world where everyone everywhere is protected by equitable and effective public health systems. You can learn a lot more about us at vitalstrategies.org, and you can sign up for our newsletters if you like as well. So without further ado, I'm going to turn it over to our first presenter, Pallavi Puri, to introduce herself and present for us. Thank you.
Thank you so much, Rebecca. Thank you so much, everyone, for having me here today. I am Pallavi Puri, and I am the Communication Manager for Food Policy Program based out of New York City. I have worked in tobacco control for almost a decade, so it's always going to be close to my heart, and I'm very excited to present here today. Let me just quickly share my screen into presenter mode. Okay, perfect. So everybody can see my screen, right? Probably. Okay.
Yes.
Awesome. So today I'm going to present a model for communication strategy that Vital Strategies has been using. It's called Aspire to Change. Aspire is basically an acronym, it's an acronym. It's a 5 steps model to guide public health advocates and communication professionals in the development, execution, and evaluation of a communication strategy to effect needed change. So I want you all to remember these 3 words, which is development, execution, and evaluation, as this is what you will see throughout the presentation. Sorry, I don't know why my presentation is not moving. Give me a second to fix this.
Try using the arrow at the bottom.
Yes. Okay, perfect. Yes, so here, a big picture of Aspire is A stands for analyze the nature and scope of the problem. S stands for strategize the communication plan and steps to create the needed change. P stands for prepare all the resources needed to execute the strategy. I stands for implement the communication strategy. R stands for review the activities by using monitoring tool and assessing current situation. And E stands for evaluate the process, outcome, and impact to register success and help inform future efforts. So this is very straightforward, right? And so this is why we wanted to give you a big picture of what Aspire is. And however, at the same time, we wanted to dive deeper into each step and what each step includes. So as you can see, this is the big model, and it includes a lot of different steps under each of the big steps. And as you'll notice here, we have those big orange boxes in between. They're basically the deliverables for after each step. We wanted to make sure that while we are going through each step, we also bring out a deliverable or a report that we could use and feed into our next step. So don't worry, I'm not just going to take you through keep you on this slide and take you through each one of this. I'm going to move with one step at a time. So moving on, A stands for analyze the nature and scope of the problem. So this is the step where you want to gather and understand the information that can help you clearly define the problem, the health problem that you are tackling. It's important to identify your health problem because the next step, which is the PESTEL analysis, it's an acronym for political, economic, social, technological, legal, and environmental analysis, will happen will happen for this specific problem. So you want to make sure that you have that specific problem defined so that when you look at that problem with these different lenses, you are just looking at that problem from a political lens, an economic lens, a social lens, technical lens, legal lens, and environmental lens. Now, once you've done that analysis, you want to find the gaps in knowledge and capacity, because now you know your problem in and out, right? You know it from all the lenses. You're able to look at and find the gaps in knowledge and capacity that is needed to tackle the problem that is in front of you. Then you understand and I'm using the word understand the target audience, because before we even identify our target audience, you want to make sure that you're looking with an open mind at your problem, and you're seeing all the audiences that are present in front of you, and then understanding them, and then basically going and defining your audience. But before we even jump to defining, you want to make sure you understand your target audience, your stakeholders, and the environment the current problem is in. It's also essential for you in this step to make sure you analyze your opposition that could be affected by the needed change, or that could tamper your needed change. I know sometimes stakeholders and oppositions are kind of intermingled, because stakeholders are anyone who are affected by the policy or by the behavior change. But in this case, we wanted to make sure that the opposition is separate, because a lot of times we skip that, and we didn't want to do this. We wanted to make sure that you are considering opposition when you're doing the analysis. Now, when you've done all of this analysis, I'm sure this is like a lot of information, and we don't want to put all of it into our analysis report, right? We want to make sure that you pick out key findings from each one of these pointers and put them into your analysis report, so that it feeds into your next step, which is the S for strategize the communication plan and steps to create the needed change. Now, this is the step, like you all know, to create change, you want to make sure you have clear objectives and you have a defined primary or secondary target audience. Now, beyond that, you also want to make sure that while your objective could be a simple advocacy for policy, right? That's a bigger picture. You're looking at a policy advocacy framework where you want to change a policy or you want to advocate for a policy. But here we want you to start thinking a little smaller and think of what you can do right now through your communication strategy that will affect or that will advocate for the policy change, right? You don't want to talk about, okay, I want to bring in this policy change, or I want to advocate for this policy. We all know that, right? What we want to do is we want to clearly define what can we do to advocate for policy change. And then, as you can see here, we also have key performance indicators. Most of you might know what it means, but key performance indicators are basically quantifiable indicators that make sure you understand if you've achieved your objectives. A lot of times, and also a lot of models mostly have objectives, which are like SMART objectives. But in this case, as we are evolving into the time of digital media and other platforms, we want to make sure that we are using terminology that can be used to see if your objectives are being achieved. Now, having said that, you don't have to have key performance indicators, like one key performance indicator for each objective. You could have multiple key performance indicators for one objective, right? So you want to make sure you think about it and write that down in your strategized stage. Now, second is, once you've identified your specific objectives, you want to define your primary and secondary options. Now, in the last stage, as you remember, in your analysis report, you already have a lot of information of your audience, of your stakeholders. So this is where you use that information and you define what is that primary or secondary target audience that will help you achieve the objectives you've clearly defined in the strategized stage. You don't want everyone that is there in your analysis report. You want to make sure that you're only picking those specific audience that will help you achieve the objectives you have defined here in this stage. The third box here, as you can see, is response options. Now, a lot of times we write communication strategy here, like our communication platforms, but in this case, we wanted to write response options because we have seen over time, our approach to campaigns have evolved, and it's not very unidirection. We don't have just one direction for a campaign. It could be any type of campaign you want to do. So the response options makes it wider and makes sure that you have the ability to think through any type of campaign you might want to do to bring about to achieve those objectives you have mentioned in this stage. The fourth box, which is research objectives, this is where you clearly define what are your research objectives, what do you want to achieve through those research objectives, and when would you like to do your research. It will, having those research objectives clearly defined in this stage will help you be better prepared, and also make sure that you're not missing out on that exact time when you should have done your research. Because, there are a lot of times when we're in the middle of the campaign and we realized, oh, we should do an evaluation or we should have done a pre-test. But following this strategy will make sure that you are already thinking of research and making sure that you are having that down on your paper, on your strategy document. Now, the last box, which is resources. We can have amazing an X number of objectives, key performance indicators, like or even response options, but we have to be practical, right? So you want to, that's why the last box is a reality check. Do we have enough human, financial, and technical resources needed to achieve what we have defined in the first two boxes, in the first 2 to 4 boxes? So you want to use this opportunity to clearly define everything that you have, your timelines, like if there is a political situation happening, like, or your financial capabilities, your human resources. You want all your resources mentioned here, so that everything, including your objectives, your response options, research objectives, resources, are in one document, which will be called the strategy document. That is your box here. And you can see when I zoomed into this model, I wanted to make sure that you see both the boxes, which is the analysis report and the develop strategy, so that you see how important it is to feed the information you've learned in analysis into your strategy document. Now, once you have your strategy, you prepare all the resources needed to execute the strategy. Now, this is where you are going to prepare or clearly define your key messages and campaign materials. You're going to pre-test your campaign materials. You're going to make sure that if you're adapting any campaign materials, you want to make sure that they resonate with your audience. So this is where you clearly define your key messages. You have a clear, you do your formative research. Even though it says prepare, this is, however, because in this case, we're preparing the campaign material, you will be doing your formative research in this stage, so that it can help you prepare the materials that are needed to implement the campaign. Now, the third box is the message distribution plan. Now, this is where you plan everything, literally. So if you have your digital media, your mass media campaign, anything that you're planning to do for your, or any response option you have decided, this is where you do the planning. It should include, you should outline your, this is where you develop a comprehensive strategy in which it has your plan, it has your resources, it has the people who will be involved in managing the distribution of the messages. And in simple terms, a lot of times it's called media planning, but because it has been called separate things on different platforms, we've used the term message distribution plan. This is also the stage where you mention all the valuable contacts you have, the people you would want to be involved in the distribution of your messages, because sometimes you do involve general public or influencers or stakeholders to distribute your messages. So this is the box where everything should be included. When it comes to distribution of the messages you have defined in the first box. Now, the fourth box is stakeholder prioritization. This is where you prioritize your stakeholders. This includes both your supporters and opposers. So you engage your supporters and you build a coalition in this stage. This is where you're basically activating them. You're not really getting them into action, but you're making sure that when in the next stage you want them to get activated, they're already aware. So you basically start prioritizing what are the stakeholders I want to reach out to, and what are the opposition I want to stay alerted about. The last box, which a lot of times we let go of, but it's very, very critical considering we're in the stage where digital media has become such an important part, and also for mass media, but monitoring and evaluation tools. This is where you set everything up. You don't wait for the end minute to set up your evaluation tools, but you at this very stage start setting up your monitoring and evaluation tools. Monitoring tools, I'm sure Rebecca can share with you later, but we do have some monitoring tools that you can use to monitor your campaign and inform your strategy live. So you want to make sure that you're not going to the end of the campaign and then updating your plans. You want to monitor the entire implementation of your campaign and even update it as and when needed. So once you have all of these boxes covered, you make a work plan. Now that work plan is something you abide with and follow in the next stage, which is the I for implement the communication strategy. Now, this is very straightforward. This is where you place your campaign or you distribute your messages. So whatever you had in your distribution plan, this is where you execute it. So most of your work, if you see, was in prepare. You wanted to prepare your campaign materials. You wanted to make sure that they resonate with your audience. You wanted to have an idea of how you're going to actually distribute those campaign materials, or which are the stakeholders you're going to prioritize, and also set up your monitoring tool, right? So you did most of your work in prepare. Now in implement, you're just going to abide with what is there in your work plan so that you know if it doesn't go through or it doesn't achieve what you wanted to achieve, you're able to tweak exactly what didn't work. So you want to make sure you abide by the work plan and not make any changes when you're actually implementing it. However, having said that, because you have your monitoring tool in place, you can update your strategy based on whatever you're monitoring throughout the process. So moving on, the first box is you place your campaigns, you distribute your messages the way you defined in your media plan or your message distribution plan. The second is, this is the stage where you shape public opinion. Now, if you're working to advocate for policy change, this is where you, whatever objective you had to achieve that, to advocate for policy change, you shape public opinion based on it. You do press launch, you do PR, you do media engagement. So this is where you used all of these things, which are press launch, PR, and media engagement, to shape public opinion. Third box is network mobilization. So now you can see, like, the prepare stage had prioritization. So you were trying to figure out which other stakeholders you want to prioritize. Now, in this stage, you're basically mobilizing them. You're getting them into action. You're implementing what you had defined in the prepare stage. And then you move on to counter opposition. Like I said, like when you were prioritizing your stakeholders, you weren't just prioritizing your supporters, but you were also prioritizing your opposers. So this is where you make sure you counter your opposition if needed. And there are various strategies to do that. It doesn't necessarily have to mean you counter them by writing back or by responding. There are also other ways to do it. And that's another discussion, but you want to make sure that you have a plan to counter opposition. And the last but not the least is monitoring. Again, you had monitoring in prepare stage, but this is where you were setting everything up. You were setting up your toolkit. You were making sure that you will be able to use that toolkit for your specific campaign. But this is where you start implementing your monitoring toolkit. You start feeding in the information that you're getting after placing your campaign. Then once you have implemented your campaign, you move on to the next step, which is R for review the monitoring. This is R for review the monitoring, and this is, I think it went to E. 1 second. I can't see anything on my screen.
You're on review.
Yeah, but I'm not able to read it. Okay, I'm on review. I can't see my screen. Yes, so this is where you review your plan, the entire implementation, by assessing the monitoring tool and current situation. So this is the stage where you a lot of times we jump directly into evaluate, and this is a big discussion we had within our team as well and programs. But this is the stage where you are, before you go into evaluating the impact of the campaign or how it worked, you want to make sure you use your monitoring tool and you assess your current situation. Were you able to change what you wanted to change? Were you able to achieve the key performance indicators that you had defined in your second stage? If not, this is a perfect time to go back to develop strategy and make sure that you are reviewing your messages, your formative research, whatever you had in place, and if it was implemented perfectly. If it was and something was not achieved, then this is the time you tweak it based on your learnings. Okay, what didn't work for us? What worked? Which is why monitoring is so essential, so that you are able to monitoring along with following your work plan is so critical, so that you're able to connect the both and make sure you tweak based on your learnings and then do the whole process again, right? Like, it is possible that what you defined as your key performance indicators didn't really work to achieve the objectives, to understand if you achieve the objectives. So you change that, or your target audience maybe wasn't the best for you to achieve what you wanted to achieve. So you tweak that. So based on whatever you are assessing in your monitoring tool and current situation, you update your strategy based on the same. So you don't have to wait till the evaluation. You can actually do it before evaluation in the review process and go back to your strategy and do the whole process again. And then when you come back to review, you again check if it worked or not, it did not work. And if it worked, you move on to the next stage, which is called evaluate. Evaluate the process, outcome, and impact to register success and help inform future efforts. So this is very straightforward again. This is where you evaluate straightforward, but not easy. And I know the research team is going to come later in this webinar to explain, but this is where you evaluate your process, your objectives and KPIs, and the impact of the campaign. Also, one more thing that you want to make sure that you have here is, how are you going to disseminate your results that you find in your evaluation? So this is where you are finally understanding, okay, was the campaign impactful? Was the process implemented the way it was supposed to? Was it the most effective way? And then based on that, go back to your strategy and revise it if needed, or start a second phase of the campaign if needed. So this is basically the entire model. It seems, I don't know how it seems to you, but I know to me it seems a bit overwhelming sometimes, but it's very straightforward. And we want to make sure you have those stages in between where you reflect, which is why we have clearly defined where is that opportunity for you to reflect and also make changes if needed. I think that is it from my end for now, but I'll pause here for any questions, or if anybody from my team wants to add anything I might have missed. Thank you.
Thank you, Pallavi. Let's leave this slide up so that people, if they have questions on any piece of the Aspire model, they might be able to ask them. If anybody wants to ask a question, either in the chat or just by raising your hand or speaking up, this is a good chance now.
Actually, I have a question. Sorry, my camera's not on. So thank you, Pallavi, for this. It looks like a very comprehensive way of thinking about actually any project, not only campaigns. Pretty impressive. And my question or my comment is, I see the involvement of stakeholders mostly in every single step of the model. And how important do you think is involving, you stated stakeholders being also opposition, involving opposition in our, like, where do we put them in our strategy? How are we thinking about them? Do we need to communicate our messages directly to them, or just to consider them in our planning?
Thank you so much. That's a great question. So stakeholder, like, as you can see throughout the different stages, and you pointed that out, we do have stakeholders and we have different ways of looking at stakeholders, right? First, you're just understanding stakeholders. So this is where you're understanding, okay, who are your supporters? Who are your opposers? And now there are different ways to look at stakeholders as well, as you know, like there are various models to define that. But in this case, we want to make sure that you're aware of your oppositions, need not necessarily, like I said, engage them, because every opposer might be, you might need to have a different strategy to tackle different opposers. Some might, and there is, again, a different model to explain different types of models and of different types of opposers and how you can tackle them. But definitely you want to make sure that you keep them in your strategy, you keep them in your mind, and you are making sure you are basically, there is this, I'm forgetting that word, but you are keeping them, you're tracking their actions, right? For example, there was a campaign in tobacco control where we were talking about change in pack warnings, right? And suddenly a farmers group started talking about, no, this is going to affect our livelihood, right? But it doesn't necessarily mean I have to respond to those farmers, but I want to make sure that I'm tracking what they're saying. And in our campaign, if we are able to tweak it without saying it directly to them, we can. So it will always have a different strategy. So you want to make sure that you're tracking the conversations that are happening both by your supporters and your opposers. Supporters, of course, every time you engage them, and the level you engage them at is again different based on the kind of supporter you have. But opposers, you're always supposed to track, and which is why we have them throughout every step, because we want to make sure you don't forget about them, which we do a lot of times, because we're mostly focusing on target audience, which are the people that are affected by the change and that will benefit from this change. But stakeholders are the people that will be affected, right? So you don't want to forget them while trying to target audience that will benefit.
Okay.
Does that?
And I have another question with
Yes.
regards to audience. How do we define who is our primary and who is our secondary audience? So when it comes to policy, we're thinking of policy. So is my primary audience the policymakers or the people that will benefit from my work or my message eventually, my policy change?
That is a great question. And I know Rebecca would be also a great person to answer that. But I'm just going to, from this model perspective, I know when we're talking about objectives, that's why first, I'm going to tell you a secret. First, we had primary target audience in the top, and then we had objectives. But then we realized that, when we were doing our campaigns, that we always describe our objective first. And then based on our objectives, we define our primary or secondary target audience. Now, having said that, they could be anyone. They could be people which are your policy makers, right? Because either you want them to be influenced and take action. So it could be your primary audience could be your policy makers, and your secondary audience could be your general public that is pushing the policymakers to take actions. But again, it could be the other way around. So your primary audience could be your general audience. If your objective is to increase the conversation around this topic. So for example, if your policy is not really talked about right now in your country, you cannot directly ask a policymaker to talk about it or to support it. You have to put pressure, right, through the general public. So this is where your primary audience will become general public, where they're putting pressure on the policymakers to take action. However, if there is another situation where policymakers already support it, and you want to make general public agree with a policy change, then it becomes the other way around, right? So it's always dependent on your objective. And your primary and secondary target audience is always dependent on your objective. And it's like, that's why we kept both primary and secondary, because a lot of times they kind of switch their place based on the objective. Does that clear? And Rebecca, please feel free to add if I've missed anything.
I think it was a great answer, Pallavi. I don't have much to add. I guess I would say sometimes you also have a target primary or secondary that's journalists, because they will write stories and get this in the news and in the air. And so the more that everybody's talking about it, the public, the stakeholders, and the press, then you have a perfect storm to get your policy win. So that's the only other one I would add, but I think you answered the question very smartly. Does anyone else from the Vital team want to say anything about this? Okay. If not, are there other questions? Dr. Naveen, are you there? I'm sure you have questions.
Dr. Naveen, yeah, she's there.
Well, I'm here and I'm still digesting. I'm trying to define my primary and secondary targets. So I'm thinking in the thinking process.
Yes, and maybe if you have questions just about the whole model, if you have questions, we welcome them, and you have the experts on now, so you can think about them later too. But this is a good time if there's any questions you have.
I have another. Well, can we go over response options again? I don't think I got that very. So the third box, and why is it in strategize?
Sure. So basically, response options is the kind of campaign you want to do, right? Like, so basically, a lot of times here we'll say campaign strategy or the campaign plan. But in this case, we said response options because sometimes we're doing a digital media campaign, but sometimes we're doing a mass media plus digital media campaign. The other times we are just activating offline campaigns. So we did not want to restrict ourselves to any type of communication campaign. So which is why we decided, okay, we will keep this as response options, because if there is a problem and there is an objective to tackle that problem, then what is that response option that can help us achieve that objective? Now, that could be activating offline support groups, right? Or it could be an online campaign along with that. So the response options is basically a fancy way of saying you can do any campaign. Any type of, you can respond to the problem in any way you want without restricting yourself to a specific type of communication strategy. Does that make sense?
Yeah.
Perfect.
Thank you.
If you have any questions, you can type them into the chat. You can ask them in Arabic. You can just speak up. If there's anything else.
And also, Rebecca, I'm happy to stay on call. And I guess I understand it's taking time to digest so much information. So I'm happy to stay on call. And if at any point anybody has any questions, I'll be happy to answer throughout them.
Thank you, Pallavi. That's great. That's great.
Just I have just a quick question because I didn't digest the whole thing, but the review part. If we are looking at the time frame, at what time should we review? Is it after 1 week or 1 month from implementation we can review and then we continue? Or so what is the exact timing for review? Because you mentioned we review and then we can go back again, strategize, prepare and implement. Maybe I've missed this, but I'm trying to digest and understand where exactly the review fits.
That's a great question. Thank you so much. I'm actually going to bounce that question to the research team. So Lisa, Ashish, Nandita, any one of you want to answer that question?
Okay, I can jump right in. Thank you for that question. It's a good one. And, Lisa and Ashish will go into this in more detail in their section. And if we don't fully answer your question, we can come back to it. But in brief, you're essentially reviewing a campaign's delivery pretty much throughout the process of implementation, immediately following it, and subsequently after an outcome evaluation is conducted, really further refining your understanding of how the campaign performed. So that review process really occurs throughout with different pieces of information throughout that process. A process evaluation or monitoring provides some data in terms of how the communication campaign was implemented and therefore provides continuous review ability. An outcome evaluation conducted at the end will provide different kind of data and provide yet another moment and a different kind of opportunity for review. So while in our model, we have review at the end to really focus it in there as a stage, it doesn't mean that it isn't a constant underlying function throughout the process. I hope that answered the question, Dr. Naveen. If not, please let me know. Yes, so you ask now, very clear, we're talking about process evaluation. Yes, it's process evaluation through the life with the full data available at its conclusion, and then matched with the outcome evaluation data to provide a fuller picture.
Clear. It's very much clear now. I'm putting the different terminologies together. So now it's very much clear. Thank you very much.
For the rest of the group, just to put some context into what we are talking about and why we're attacking Dr. Naveen, because we're working currently with her and Birzeit University in Palestine to launch or to continue a campaign that started last year. And this year, we want to focus more and more on policies. And together with Dr. Naveen, we are working on shaping our strategy or our work plan and logic model to create an effective campaign. And we're also doing the same thing in Jordan and with our partners from the Royal Health Awareness Society. I think we have someone from RAS, from the Royal Health with us. We're also focusing on policy, again, in Jordan, and hopefully we will come up all together with a plan, a strategy that will prove to be effective. I guess most of you have seen our campaign last year, our United Against Tobacco campaign. At that time, we were not really focusing on policy. We were focusing on maybe raising awareness. Our focus was on the general population, the harms of tobacco to oneself. And now, because we saw a lot of actually positive results and positive feedback from everyone, we want to take that momentum and just focus more and more on policy to cause more change. We have Adriana. She has a question. What do you suggest for partners who are very interested in enacting this process but have limited resources or no team in place to get started and facilitate? Any resources or websites that you can recommend?
Great question, Adriana. I think, but I wanted to get some clarity. When you're talking about not having have limited resources or no team for enacting this process, what do you mean? Like enacting this process in the sense, the scope of this process, or putting everything on paper, like this plan, or actually executing the strategy? So I'm a bit unclear.
Yeah, no problem. Hi. My question was more geared towards, like, I think a lot of the process that has been outlined here falls under the scope of maybe like a communicator or, you know, like a health communications team, not necessarily like the primary researchers for tobacco control. And so what we'll see, like let's say in my scope of work is research will be done, data will be collected, but then dissemination of that data will fall off because there's not staff or you know, trained communicators on the team to take the data further. So, but the teams themselves are very interested in doing, you know, especially like the implement of the Aspire category. So I just wanted to know, like, whether you all have experienced that with any partners, or if Vital Strategies might have guidebooks or learn webinars or something that can be shared with those partners to help them. I think obviously Aspire and this process that we're looking at is excellent, but I think there's a learning gap of getting to the point of knowing what to do with the Aspire model.
Absolutely. That's a great point. Thank you for bringing up the practicality of the model. We do have a guideline for this Aspire strategy, for this Aspire model, and we will share that with you all soon. I think we're yet to publish that, but we do have a whole guideline on how, you know, like these boxes, like I had First, I had the Aspire, just an acronym, then we have this, but now we have another document that explains each step in detail so that you're able to execute it yourself. However, beyond that, about webinars, I think Rebecca can add more to that. But with regard to this model, yes, we do have a guideline that can help you. And we also have a few toolkits that does support these different boxes, but we are yet to create toolkits for each of these boxes. But yes, we will share that with you soon, but I'll bounce it up to Rebecca now to add about the webinars.
Yeah, I'll just add that we are creating, and by we, I mean this partnership of Emphanet and Vital, a website that's going to house everything related to our work on this project, which is to United Against Tobacco, and how to do communications campaigns. So it will be great for you to visit that website as soon as it's up. We're hoping to have it up maybe by the end of the month. So Rhonda can follow up with you on that. And also we shared a lot of different tools in the first set of webinars we did. So again, you'll be able to see those tools in those websites, in those webinars, which are going to be on that website. So give us a little bit of time, but I think by the end of March, we can share quite a bit with you. And Rhonda, if you get the details for Adriana, we can follow up.
Yes, of course. So as Rebecca said, and as I stated earlier, we have already hosted 5 webinars. Each webinar focused on a specific topic last year. And all of these webinars and slides, they're recorded and they're available. If you personally want them now, I can share them. Just contact me and I can share them with you. But we are, as Rebecca said, creating this website, which I am personally very excited about because it will have so much material. The material is going to be capacity building material. It is going to include actual campaigns that were proven to be effective in several countries in the Eastern Mediterranean region and actually beyond. And we have material in Arabic, we have material in English. So hopefully soon we will be able to share this with everyone and for everyone's benefit. These materials will be available for anyone who wishes to use them and utilize them to fight tobacco.
I just want to add to Adriana, I mean, campaigns can be big or small. And if you're one person, you can't honestly do all of this, but you can take on some things. Like, for instance, you could write an op-ed to your newspaper and get press for an issue you care about that could bring the issue up to the front. Or you could create a fact sheet that could be distributed that could help, something like this. You could get on television and do interviews about what you care about and what you're trying to do with a campaign. There are some materials that can be distributed, again, on like radio or social media quite inexpensively, and we're going to talk about those too. So Adriana, I'm happy to have a conversation with you if you let me know a little bit more about what you're thinking, what you want to do, what campaign you want to do. You can take bits and pieces of all of this and create something. It won't be everything, but it can help. It can move the process forward. And I think Dr. Naveen is a great person for you to talk to because she kind of single-handedly took this on and with a little bit of assistance was able to do quite a lot. One champion can do a lot. So just keep that in mind. It takes one person to make a change, right? Or definitely it sounds like you're interested in that role. So I commend you. Any other questions?
Rebecca, I just wanted to add to your point about not needing to do everything. And that's so true. And I should mention that because in prepare and implement specifically, this is like a bucket list, right? You want to do everything, but you don't really necessarily have to do everything. So you can pick and choose your battles. And if you want to shape public opinion, you want to just mobilize network, or you want to do campaign placement, you can choose and plan accordingly. So you don't have to do everything that's mentioned here.
And you can't do it all yourself, but you can have partners who can help. So you need a communications partner maybe, or you need, stakeholders partners, et cetera. So I think there are ways to do it. The idea here is to think through these strategies so you get the results you want. I think if there's any more questions, we're totally willing to take them. Otherwise, I would suggest, Rhonda, we take our break now and we'll come back with the 2 other presentations. And if you want to stay on during the break and you have any questions, we're happy to be available. My team is happy to be available for that too.
Yeah. Thank you, Rebecca. Let's go to our break and come back in 10 minutes. So it's 5:50 now in Jordan. I have no idea what time it is in the US and India, but in 10 minutes we will convene back here. And thank you, Pallavi, and thank you, Rebecca, and see you in 10 minutes.
Thank you.
Thanks. Feel free to ask questions while we're available during the break as well. And thanks so much, Rhonda, and the team.
Hello and welcome back, everyone. Now we move on to our next session. We have our monitoring and evaluation team. Ashish, I'm just gonna just introduce yourself. Just please go ahead, and we'll be sharing our slides from our side. Ashish and Lisa, please go ahead.
Thanks, Rhonda. Thanks, everyone, for this session. And hi, I'm Ashish Gupta, working as Associate Director Research, part of Global Research Team at Vital Strategies. I will be undertaking this presentation along with my colleague, Elizaveta, who is really experienced research manager based in New York. So we'll do this PPT, Rhonda, in two parts. Slide, will you be running the slides?
Yes. Here they are.
Yeah. So if you can go to the next slide, please. So we'll do this PPT in two parts to describe how research and evaluation can strengthen media campaign, particularly for policy change. And we will then describe how two different approaches, formative research that is used early in the combination campaign planning cycle, and then outcome evaluation, which is used upon its conclusion. I'll deliver the first part and Lisa will deliver the second part, and then we'll have time for questions in the end. Now, during the presentation, we'll discuss why communication research matters, how research evaluation can enable policy change communication campaigns, and then we'll present the types of research conducted when to advance policy goals. Yeah, so quickly on the background, if you can go to the next slide, Rhonda. First of all, communication research and evaluation are crucial to successful policy media campaigns. This is because research and evaluation can help us to assess whether communication efforts delivered as intended. They help us identify unintended consequences of the campaigns, and they allow us to document lessons for future use and to build communication sciences. They also allow us to learn about what worked and advocate for it in program goals, and then it ultimately helps us in protecting our investments. Next slide. Yeah. So media campaigns work through multiple ways. They work both through direct and indirect means. And in the indirect way, they change individual knowledge, attitude, and behaviors. They also work indirectly to shift norms. They build public support for policy action, which leads to policy change. Yeah. Next slide, please. Yeah. So now research is conducted at multiple stages. Pallavi has already described these different stages. So briefly, during campaign development, formative research is undertaken to identify target audiences, appropriate media, and effective communication material development. And during campaign implementation, we talked about this briefly during Pallavi presentation, process evaluation or media monitoring to assess whether the campaign is being delivered as planned. And after the campaign evaluation, the impact evaluation is undertaken to assess campaign effectiveness and overall return on investment. So this research is conducted throughout, these are the possible options which are conducted throughout the campaign life cycle. Now, going briefly into the formative research part of it, the message testing, which is a part of formative research, is a kind of formative research approach that tests message effectiveness among the intended target audience. And it tells us Do the message resonates? Do they motivate desired actions, including for policy support? Communication messages and materials are tested before production, and this is the time at message testing that we do the same. Now, message testing can be used to assess materials intended for different media, including radio, social media, billboards, etc. And the methods which are used are primarily qualitative and can do briefly quantitative ratings also. Next slide. So message testing studies, as I just mentioned, they use mostly qualitative data, but they also use quantitative information is gathered through a rating of different aspects related to campaign material. And message testing studies measure if campaign materials are good enough to get noticed. They are good enough to get understood, remembered, and motivates action. Do they motivate action or not? And the examples of some of the measures that help us, I undertake and perform this message testing is if the measures could be something like, if it taught me something new, was it relevant to me? Is it easy to understand? Is it believable? If it motivates me to sign a petition or made me talk to someone else about it. And the entire discussion, the group discussion is made and it's structured in a way to perform this message testing around these examples of measures. So with this, I come to end of my part and I hand over my colleague Lisa for the process and outcome evaluation. Thank you, everyone.
Hello, everyone. It's a pleasure to be here today. I will continue our presentation and we'll talk about process and outcome evaluation. And you've heard a lot about it already. So if I repeat whatever was said before, I apologize for that. So the process and outcome evaluation, as Pallavi mentioned, as Ashish mentioned, are very important for the development of a successful campaign. So what is the difference between the two? Process evaluation and monitoring, for example, they are used often interchangeably. So this evaluation helps us to assess whether the media campaign is being delivered as intended. It assesses whether the key target audience received the campaign message, and it's also whether the target audience responded favorably to the messages. Outcome evaluation, on the other hand, it assesses the effectiveness of the campaign. And it measures whether the campaign reached its objective in terms of changing knowledge, for example, attitudes and social norms. Did it build some public support to certain policy that you're trying to move forward? And did it finally change the behaviors? Next slide, please. So Ashish also spoke about the theory of change and how the campaign achieves its objectives. So it goes through different pathways. And the evaluation questions that we develop to measure the campaign, they evolve around this theory of change. So some of the process evaluation questions include, did we reach our audience? So that person sitting in front of the TV, did she receive the message that we want her to receive? How did she react to this message? So these questions will be your process evaluation questions. When the outcome evaluation questions will be how your campaign affected their knowledge, attitudes, and practices. And your final impact evaluation question will be, does the audience adopt and maintain that target behaviors? Like these dancing people, like healthy people that we would hope them to be. That will be your final impact goal. Next slide, please. So there are different options for the evaluation, and Adriana earlier mentioned what to do if you don't have enough budget for that or resources. So depending on your resources, depending on your financial and human resources, depending on the scope of your evaluation, and of course on the purpose of your evaluation, you could use different use different evaluation methods. So they go from randomized control trials, which is as a gold standard and is very expensive and very time consuming, And you could use secondary data, which can be easily available. You can get it for free, or you can pay a little bit for this data. You can also use qualitative data, which among many others that are listed here on the screen. And qualitative studies will not provide you with a representative sample size, or like representative information, but it can give you a very good insight on what your campaign affected, or what your campaign had effect on. So during the last campaign, we were able to conduct 2 evaluations, one in Jordan and one in Palestine. So in Jordan, the evaluation was a representative survey, and we were able to achieve the results. In Palestine, Dr. Naveen was able to conduct a qualitative study, and she was able to gain all the insights from the policymakers about the campaign. Both the evaluation results informed current campaign, which was very useful for the campaign development. Next slide, please. So it is also important to disseminate the findings that you get. And the dissemination plan, as Pallavi mentioned before, has to be, just like a monitoring and evaluation plan, has to be planned ahead. And I will walk you through different steps. So step 1, you need to identify your audience that would benefit from seeing your evaluation results. They could be other NGOs, they could be UN agencies, government agencies like Ministry of Health, Ministry of Education, or religious institutions, and so on and so forth. Which leads me to the second step. You need to identify what information from the evaluation each audience would find useful, and try to find out what are you trying to achieve with this result. For example, do you want to promote a certain policy, or do you want to inform public about the harms of the tobacco? So your goal will define what kind of results you are going to share. And finally, develop a dissemination strategy to reach each audience. That means that different audiences perceive information differently. Some will be happy to receive your 100-page report and go through all the statistical data that you have. For others, that will be overwhelming. So you might want to consider developing a short brief and share it with them. Like, for example, policymakers do not have time to read the report, but they will appreciate your short brief. Next slide, please. And I will share some examples with you. The information for monitoring and evaluation can be, you can get it from different sources. One of them is media planners. For example, during the last campaign, United Against Tobacco and COVID across 4 countries reached about 50 million people, which is a very considerable number of people. In Egypt and Iraq, around 25 million or more people were reached. In Jordan, around 3 million of people, in Palestine, 2.5. And they were reached through various means, through social media, through TV, radio, billboards, and so on and so forth. So you can reach your audience from different ways, and you can get your information from different ways. Next slide, please. There is also, you can also reach to the Ministry of Health, for example, and find out the data from the cessation clinics. In Jordan, for example, the cost to the cessation clinic, just to the quit lines of cessation clinics increased substantially, and you can see that on the graph here. And it shows you the numbers before the campaign and during and immediately after. And the next, the nearby chart shows you the outcome evaluation findings that we received in Jordan. And you see the difference between those who saw the campaign and those who didn't. And those who saw the campaign were substantially more likely, or significantly more likely, to support public health policies or health smoke-free policies in various areas that Rebecca mentioned at the very beginning, in mosques and educational facilities, in hospitals, restaurants, and bars. Next slide, please. So I'm going to conclude with a slide that Ashish showed you at the very beginning. And just to reiterate that campaign monitoring and evaluation, or process monitoring and evaluation, are very important for the development of a successful campaign and implementation of a successful campaign. And do not conduct your evaluation just to satisfy your donors. Do it for yourself and for your target audience. It helps you to make your campaign better. It assesses whether the media campaign had the desired effect or not. It will help you to improve it throughout the course of the campaign, and it will protect your investments. I will stop here, and if you have any questions to Ashish or I, or Nandita can also help us to respond. Thank you.
Thank you, Lisa, and thank you, Ashish. I'll start off with my own questions. My first question is to Ashish regarding pre-testing. How important is it, or how do we choose who to pre-test on? Do we have to get the specific audience that we are targeting? Do we categorize them? How do we do it? Ashish, you're muted.
Yeah, sorry. So pre-testing exercise is generally taken random with a set of target audience, with the participants of the people who would give their responses would be from the defined target audience of the campaign. So in terms of different socio-demographics, how we have defined the target audience for the campaign, from those set of people, we draw a sample, a purposive sample, and then we generally, we do a focus group discussion kind of setting, where such participants per group would be around, say, 9 or 10 in number, and they would have, they would be asked certain set of questions in a formal setting, and then the discussion is moderated. So, to answer your question briefly, Randa, it's that the target audience of your campaign defines and decides who would be the participants, who would be just,
Okay. Thank you. And my next question is for Lisa with regards, so we do evaluations, and when we did the evaluation in Jordan, and in Palestine, we tried to do it as soon as the campaign ended. We needed to see the effect directly after it ended. What about impact? When do we do an impact evaluation? Do we have to wait months, 6 months? Do we actually do impact evaluation?
We can do impact, like one of the reasons, just to go to your question, one of the reasons why we do the outcome evaluations immediately after the campaign is because the lifetime of the campaign is very short, and the memories of the campaign can fade like within some time. So we want to receive the feedback about the campaign immediately after it. In terms of impact evaluation measures your goal, the ultimate goal of the campaign. And it measures whether or not, like I said, I mentioned one of the questions, it's whether or not your target audience adheres to certain behaviors. So you will not find out about that immediately after the campaign, but you can go with, say, with like maybe 6 or 1 year. I mean, the usual program, they will go into the field maybe 5 or 10 years after. But in terms of the campaign, I would say you would go there sooner, but Nandita is here and she can give you a better answer for that. But you will measure the changes in behavior with them. Nandita, do you want to jump in?
Sure. Thank you, Lisa. The short answer, Randa, is one can actually get impact with media campaigns. And this is why they are a best buy. They are a cost-efficient and effective solution for tobacco control, because media campaigns, even on their own, can result in quits and cessation behaviors. So we know this from a number of studies. As Lisa said, we go into the field very quickly because we want to measure very quickly the impacts of the campaign. But in certain markets, we might even find cessation behavior right away. And we've published on this. We've found increased quit attempts, and we found these to be highly cost efficient in some markets where there's relatively little cessation information. In an ideal scenario, one would follow up on this in 6 months, 1 year, as Lisa said, because ultimately media campaigns have to be run many times in a year to reinforce that behavior and ultimately to see population level change.
Thank you. And actually, this is just giving me ideas about the campaign that we conducted in Jordan. And Lisa, you actually showed the slide where the calls to cessation clinics in Jordan increased during the duration of the slides. And maybe if we follow up on these individuals that actually called, maybe we would find, let's hope, some impact. And some people were actually able to quit smoking. We can discuss this maybe after the second campaign in Jordan or the continuation. We had a question in the chat box from Dr. Youssef with regards to using randomized control trials and how difficult it would be to randomize or what are we randomizing when it comes to evaluations or post-campaign evaluations. And Nandita, thank you. You answered in the chat box that usually we need to plan ahead and carefully if we want to conduct a randomized control trial. And usually these are difficult and we might consider looking at a dose response relationship. Can you, Nandita, explain this a bit more, what you mean by dose response?
Okay. So to the clinicians on the call, think of a media campaign like a pill. So essentially, for a medication to be effective, we know that it must be administered at the right dose for the right period in order for it to have an effect. And sometimes it may be something that needs to be taken continuously and in an ongoing manner. A randomized controlled trial is essentially what from certain disciplines is considered a gold standard for measurement of any intervention's effectiveness. So in a randomized controlled trial, we would have one set of people that received the campaign and others that did not. In this case, one set that would receive the dose and others that would not, and we would compare the two to see whether those with the dose did better. But in reality, communication is a lot messier than a pill, and it's hard to control where it goes. And that's the contamination effect that was described in the chat. Yeah. So in that case, what we're really looking at is, does variation in the doses received, can we relate that to impacts? If we can, then by reason, the dose must work. If at lower doses, we had lesser impact, higher doses, greater impact, then it stands to reason that the dose, in this case, the communication campaign, was in fact effective. So these are different analytical and deductive approaches by which we can measure a campaign's impact. And where we might not have gold standard approaches, there are these other more modest, but also reasonable approaches that one can apply.
Thank you. And I think this might answer another question in the chat box about from Adnama Aita on how can you set a realistic time frame to reach the change you are looking for, and when do you start to monitor behaviors? So would this be linked to the dose of a campaign? So how frequent or how intense the campaign was, change in behavior?
I'll kickstart the response, but I look to Ashish, Lisa, please jump in, as Rebecca, Pallavi, anyone else that wants to. In this conversation, we're really talking just about media campaigns, but that's not the only thing in people's environments, in tobacco users' environments. They're in environments where they're receiving heavy marketing of tobacco products. They have it at their fingertips in points of sale. They're surrounded by those who are consuming, smoking, exposing them, and thereby also influencing them into behavior. So the media campaign and how well it works has to be considered in the context in which it's being applied, and considering all those opposing factors that will reduce its potential effectiveness. So this is where, as I said earlier, in some markets where it may be the first time something's communicated, the first time information and that motivating message is made available about the harms of tobacco consumption, maybe we'll find very quick response, especially if there's not a lot of counter pressure. But if there is that, then we have to amp up our media campaigns, also look at the comprehensive package of policies that are critical for ultimately reduction. So unfortunately, there is no quick answer. It really depends on context and the delivery of this intervention along with others. Rebecca, did you want to add anything further here?
You're muted, Rebecca.
Sorry, I just wanted to say, and maybe this point has been made, but it takes more than one campaign. If you really want to get change and long-term change behaviors, then you really have to go at this in a systematic way. In fact, we say that campaigns should be on the air most months of the year to really keep the change going, really push for the policy change, keep youth from initiating, and also to get cessation. So it's a long-term process, I think, and that's why we're trying to provide some tools for that to you all in the form of media materials. And Yaini is going to talk soon about doing it on social media, which can be much less expensive. There's also a question in the chat I noticed from Sarah and another one from yeah. Do you want to take those, Rhonda? Maybe we can.
Yeah, sure. So Sarah asked, is there a set of criteria for selecting outcome evaluation data sources? I think this question is for Lisa.
That will depend on the purpose of your evaluation and the mode of your evaluation, the mode of your campaign. So set of criteria for sources of data can be, again, it will also depend on what is your, like, are you limited in resources or not? You can conduct some of, when we speak about the sources, it's either your target audience or it could be the media channels or the media products. So again, that will depend. There are a lot of depends on that. Yeah.
Actually, before I go on to Adna's question, with regards to evaluation, we can set our evaluation questions early on, directly after we determine our objective and our log frame. We can determine our evaluation questions, and from our evaluation questions, this will determine maybe our evaluation method and then the evaluation data source.
So your evaluation question, you will have to have your theory of change. Yes, that's the one that Ashish was showing. You have to understand what you're trying to achieve with your campaign. And when you have your clearly defined outcome indicators, then you can develop your evaluation questions. So yes, based on, like as Rhonda mentioned, based on your evaluation questions, you will see whether your evaluation questions are qualitative, quantitative, or they're mixed methods. And then you will define what kind of evaluation you're going to conduct and what kind of sources you're going to use and what kind of methods as well. So that's why the planning of the evaluation should come at the very beginning, at the very initial stage of the development of the campaign.
Thank you. That's why planning is very important.
Yes, and your budget is important too, and your strategic goals are going to all go into the answers here.
With regards to budget, usually when we're planning for an evaluation for a campaign, how much do we budget? Do we say a maximum of 10% of my budget should go to evaluation, a maximum of 15%? What do you think is a reasonable budget to put for an evaluation?
Ashish can also help me with that, but I would say you don't put 10% of your budget. That will depend on whether or not you're going to hire an external consultant or agency for your evaluation, or you are going to conduct an in-house evaluation and you have experts on and again, that will depend on the purpose of your evaluation. External consultant is providing you with a neutral opinion, and when you have an in-house evaluation, it will be a little bit biased. So keep that in mind as well. But in terms of the price, Nandita, I think just mentioned 10% is good, but in terms of your price, yes, that depends on the market. Ashish, go ahead. Yeah.
No, I'm just trying to add to what Lisa said, that, a 10% to 20% is generally, good. And beyond that, that doesn't make sense. Yeah.
Thank you. And the last question from Adna, how can we ensure change is sustainable and long-term?
And I think we've kind of answered that question a little to say that you really need to keep these issues in the front of people's minds. And the whole purpose of what we're doing here today is to push policy. And if you have policies in place, well, then you get long-term change. If you have smoke-free policies in place, people smoke less. They don't smoke in public. They don't smoke around others as much. So this is what we're really up to here. It's about putting policies in place that will result in real change.
Thank you. And I think we are short on time, so we have to move on to our, thank you, Ashish, thank you, Lisa, and thank you, Nandita, for this wonderful session. And we move on to our next speaker, Yaine. Yaine, please go ahead and introduce yourself.
Sure. Thank you so much, Rhonda. Hello, everybody. Thank you for joining us. I'm Yaine Hailu, Senior Content Strategist at Vital Strategies, and I work on developing content from concept phase all the way to dissemination. And one of the main issue areas that I work on currently is anti-tobacco industry work, so exposing the industry's attempt to undermine policies all over the world. So today, I'm going to talk about how social media can be an effective part of your plan when trying to advocate for policy change. Next slide, please. And at the end of the session, you should be able to understand how social media can be used for policy change and have the tools to also create an effective strategy using social media for advocacy. And then also just knowing what kind of messages will persuade your stakeholders to help you advance your policy goal. Next slide, please. So what is the role of social media in policy advocacy? We kind of already know that social media is a very powerful tool. We've seen it in our daily lives, and we know the impact it can have. We know that it also impacts even our cultures, right? So nearly 60% of the world's population uses social media, and not just one platform. Most people use an average of about 7 platforms per month. But it's not just for entertainment. It's been very crucial in catalyzing social movements, political discussion, and setting cultural trends. Next slide, please. So we know that social media can be a great tool to get your desired policy change. In order to advance your policy, you need, for example, awareness that there is a problem. So social media can be effective for increasing visibility. You also need to find those that already support your policy change, or if you don't have that, then you need to create one. So you need social media to be a tool for recruiting support. And then also we know that you want to encourage discussion about your issue, right? And if you want to encourage discussion about your issue, or you also want to listen to what is already being said. So social media can be successful in influencing conversations and stakeholders. And then lastly, we also know, as Rebecca mentioned, that it is relatively low cost, but far reaching. Next, please. So one of the ways, or some of the ways that you can use social media in advocacy is that you can gain media attention, which means that, and this is because you have plenty of journalists on social media platforms looking for stories. It also means that you can also use social media advocacy for getting stakeholders to take action. So we already know that currently branding is kind of a necessity. You have to kind of have a brand for credibility. And it's not just companies and brands that need to create this kind of presence. Nowadays, organizations and institutions also need to maintain a brand. And so social media is a great place for everyday people to have access to influencers and policymakers. And getting them to take action could be anything from like signing letters to petitions, or creating public pressure towards your influencers. And lastly, of course, social media gives advocates access to people and communities and groups that can align with their interests. So raising awareness or funds is it can be a result of this. Next slide, please. So for policy advocacy, social media opens a lot of doors for discussion and for many voices to enter the conversation. It's also, I think the one thing to mention here is social media on its own may not necessarily create policy change, but it is most effective when combined with other activities like stakeholder engagement or other forms of advocacy. And so I just wanted to run through a quick example. Thanks. Here is an example from a Vital Strategies program called STOP, which is an anti-tobacco industry watchdog. So in this example, Formula One, which is one of the top motorsports in the world, we noticed that some of the biggest tobacco companies were using sponsorship deals with Formula One to get their brand exposure. And they were especially targeting younger audiences and a global audience because this is the natural audience for Formula One. And by getting their brand exposed to these groups, oftentimes this was violating tobacco advertising bans in different countries. So STOP produced a report that detailed how the industry was using this loophole and exposed the industry's tactics to, get a younger generation hooked on tobacco products and especially electronic products. So STOP's desired policy change was, they wanted the FIA, which is the governing body of Formula One, to get Formula One to join the rest of the sporting world and ban tobacco sponsorships. The other kind of change that they're looking for was to encourage governments to act on this issue as a cross-border marketing issue. So in terms of a campaign, STOP developed a digital and advocacy campaign around prominent races that were happening throughout the year. And it was heavily social media based, but it also had other components. So for example, the campaign used paid ads on Twitter, Facebook, and Instagram, and also included a tweet storm function, which is basically a platform that allowed our target audiences to tweet a particular person. So in this case, the target was Jean Todt, the head of the FIA and the F1. In addition to this kind of social media components, the campaign also had people had stopped creating an open letter to Jean Todt directly and also a letter to the UN with over 100 signatories. The results, and so you see kind of the examples here, some of the social media posts as well as the open letter. And the result from this campaign, which was, ongoing for, it started off as a 2-week social media campaign, but then, as I said, had all these different components leading up and supporting. It created enough pressure to get Jean Todt to respond to STOP's letter in the 2 weeks that we were doing kind of a tweet storm and other posts. And then it also, eventually this, like I said, it was kind of like a buildup. It eventually led to others kind of regional results. Next slide, please. So as you can see from that example, I mean, there were definitely some great advantages, but just to step back and kind of look at social media as a whole, before you include social media as, as part of your plan for policy advocacy, you want to think about, how will these efforts, will it actually be effective, or what are the things that we need to consider before we kind of commit to it? And as we know, like any tool, there are pros and cons. So you really want to think about your policy goal and what advantages or disadvantages there may be. I mean, the one thing that I think is obvious to everyone is that the reach of social media doesn't compare to any other platforms or or tools. Main thing here is that social media is currently one of the fastest growing mediums, with users being added every day. So the potential to reach a wide audience, especially a younger one, is tremendous and at a very low to no cost. And the other big thing is you can customize your target audience to be as specific or as broad as you want. So you can be as granular as targeting a specific location, or even kind of breaking it down by interest, and even by like events. If you've ever used like a geofencing target, you could target attendees of a certain conference or something like that. So that's always an advantage. But there are others, and I kind of wanted to ask the participants if you can think of any other advantages or disadvantages, perhaps in your own experiences. You can just chat it if there are any. I don't think I see any in the chat. Right, someone said it allows direct feedback. Anything else? Advertising is a disadvantage. Yep, it's uncontrolled. Right. Next slide, please. It's low cost. Right, so just some of the answers here kind of mentioned it already, but one of the biggest ones is that it's your own platform, so you fully control the narrative, right? It's easy to publish, so you can publish and unpublish at any time. It's fully under your control. I think someone mentioned this as well. It's a two-way conversation, so it can be an advantage actually or a disadvantage. But as an advantage, you can actively persuade audiences or encourage support by having a back and forth conversation. It's also a way to tune into the perceptions and viewpoints of your target audience. So for example, if you're advocating for, let's say, more access to smoking cessation services, you can also gauge how the community feels about cessation and what barriers exist by, having these conversations on, through social media. And then of course, as we know, if your campaign or your post go viral, I mean, the impact is unmatched. And as disadvantages, kind of as I mentioned earlier, being a two-way conversation also means the conversation can change and negative comments are possible. So as somebody said, it's uncontrolled. You kind of don't know which way the conversation is going to go. And so that will require you or your team to monitor and to also potentially have a dedicated person or an agency or other ways of kind of keeping track of what's being said. And then also just in terms of a wide audience reach, its content can being in fact impactful depends on your strategy. So sure, you can reach all these people, but are you sharing the content that that really interests your audience? Is it optimal for them? Will they see it? Will they want to like it or comment or engage with it? So the other thing in terms of other than advantages and disadvantages is there are a few things to consider. Next slide, please. So in terms of key considerations, you want to think about, and this I've actually seen people struggle with a lot, is what will it actually take to implement a full social media campaign? And you have to be realistic. What resources will you need? A lot of times I think social media is kind of added at the end or, kind of as a maybe potentially underestimated on how much resources it might take. So you want to think to yourself, do you have a dedicated social media person or budget to hire one? Can you monitor the conversation? So you want to think about these things. And then also you want to make sure your messaging is adapted to social media. So if you have a campaign that uses different components like media, advocacy, and other things, you can't just take one material and just slap it onto social media. You want to make sure that it's tailored to be optimal for that. Next slide, please. So I just wanted to take a few minutes to see, to ask you all, what part of developing a social media campaign has been the most challenging in your experience? And you can feel free to unmute yourself, or you can drop it in the chat. And so, for example, was it developing the right messaging for your policy goal? Was it creating the actual content? Having the right indicators to measure whether or not you hit your goal? Or is it, allocating enough budget or time? Yeah, Facebook rejects some posts because they were on tobacco. And I see someone saying the first two options, messaging and creating content.
Yeah.
Okay. Okay. How is the social media, how regulated, if it's regulated to start with? Right. Okay, we can circle back to these at the end when we have Q&A, but it's good to know. So it looks like a lot of it is from the messaging and creating content part of the process. Next slide, please. So we know social media is a tool, but it's not magic, right? So just because you post something doesn't mean it's going to go viral and then it's going to change. It's going to create your desired policy change. In order to get to that, you want to make the platforms work for you. You have to have a well thought out strategy. Next slide. So the first thing to do, what I would recommend is kind of taking a step back and know what your goals are. What is the policy change you're looking for? What is the final outcome? So for example, just so we can kind of go through this with an idea in mind, let's say your goal is implementing smoke-free policies in cafes and restaurants. So then who are your stakeholders? Who can make that change happen, right? Stakeholders can be actual policymakers or other entities that, have a vested interest. And you want to think about kind of, are they going to support you? Are they going to block you? Are they going to be a problem? So in this case, perhaps it'll be the Ministry of Health, or it's kind of, the establishments themselves, like the cafes and restaurants, right? And then you want to think about, well, how can you reach them on social media? There can be other components and ways that you can reach them, but how would you use social media to get to them? So you want to think about who or what would influence these stakeholders. So in this case, it could be maybe journalists having like articles or media results, right? It could also be public pressure. So getting kind of people to talk about it on social media or share information. Next slide. So then the next thing you want to do is just have clear objectives for your social media activities. Who is the target audience? So let's say in this case, you want to create public pressure. So in the city or country that you're in, culturally, let's say young people frequent cafes and restaurants the most. And they're also the ones that are most likely to catch on to a social movement. So then where can they be reached? You want to look at the channels. Different platforms on social media have, are optimal for different audiences. So you want to get to this target audience where they are. Otherwise, I think one big thing is you might be tempted to use, all platforms, but this could water down your strategy. So you want to make sure you're prioritizing the right ones. So in this case, let's say it's TikTok, because there's a lot of younger users tend to use it. Facebook, perhaps because a lot of businesses have Facebook pages, and that's where you can do more community engagement as well. So people can message the establishments directly, for example. And then Twitter, usually a lot of media and journalists are on Twitter. So you want to make sure you include that, and also policymakers. And in that case, you also want to think about, do you want to use paid or organic social? And then you want to think about your key content. What is the main source of information? You know, it should include your key messages, of course, but based on the format and the audience and the channel you're using, you know, you want to make sure that the content is makes sense for the channel. So for example, if your main audience is on TikTok, a short video would work best, right? You wouldn't want to have like a lot of images. But if you have great images, for example, that speak for themselves, then maybe your audience is on Instagram, then that might be the platform you want to use. And then of course, as I mentioned, you want to tailor your content to the platform. So we know, for example, that most adult internet users have an attention span of 8 seconds. So you don't want to create a video that's 10 minutes, right? But you can always lead people off of social media to your website to view more information. And then lastly, of course, your call to action is one of the biggest, like most important thing for your social media strategy. What is your ask? What are you asking people to do? It should have an impact towards your policy goal. So, and it should be measurable, right? So you want to make sure the call to action makes sense and leads people to kind of the policy change you're looking for. Next slide, please. And lastly, you need to set your metrics. How do you know if you're, there are many factors that affect social media campaigns. So if you need to know what you're looking for. How will you know if your campaign has been effective or not? And here are some common metrics. I think reach is the one that everyone tends to go to because that kind of shows you the potential amount of people you're reaching. But there are other metrics, for example, any engagement metrics like link clicks, shares, likes. This is actually a more useful metric because it tells you about your audience behavior. It tells you, are they actually paying attention to what you're saying? Is the content resonating? Am I, if they're liking and clicking the links, then that means that your content is getting to people. But if they're just seeing it and not acting, then you might want to revisit, what your message is. And then also, just to reiterate something that I think others have mentioned today, it's timing. So just having a 2-week campaign, on a social media campaign on its own may not create your desired policy change. And you want to think about how many times you're running your campaign. Multiple runs of a campaign is optimal. Also running it during key times. So if you know that there's a conversation or a meeting or something that's happening that's key to your policy change, you want to center your campaign, your social media campaign around that. And then also just making sure that you're measuring at different stages of the campaign. Next slide, please. Lastly, and one of the most important pieces is what messages are influential. How will you use your social media advocacy to persuade stakeholders? Like what kind of messaging will actually achieve this? The best messages combine information with emotion. So, evoking people to feel anger, sadness, joy, fear, pride, etc., is really a way to persuade. I think a lot of technical experts tend to think that data alone will attract attention or change perceptions, but that's often not enough. And you want to remember also that many audiences are not as close to the cause or have all the knowledge as you do. So they often need to be persuaded to care or take action. And the best message that will do this will inform and persuade that the cause is important. And so to persuade them, the message needs to be relatable. You have to help your audience feel connected and understand, basically they have to feel like this could happen to them or this issue is important to them, right? So the next few slides are really just a recap. They're kind of the 10 principles of social media advocacy, and we've kind of gone through all of this. So I will actually not go through these. I think everyone will get these slides, so they'll be able to kind of see this, but it's just a couple of tips and tricks on what to use when doing your social media advocacy. Instead, I want to leave the last few minutes for questions.
Thank you, Yaine. I think we have a couple of questions in the chat box. First, we had a question about how do we deal with opposers in social media? So I guess negative feedback in social media. How do we deal with that?
That's a good question. I think there are a couple of ways. So it depends on how your opposers are approaching you. So if it's a matter of misinformation, for example, then this is an opportunity to actually re-up your message and provide, stats or the correct information. And this can actually be helpful because then you can lead people to more of your content, right? Like I said, if you have something on your website or other places to point to, it also makes you more credible. You can kind of give more information. If the opposers are just there to oppose, so for example, there's a lot of trolling that happens on social media, and you know that you're never going to be able to persuade these people, the best way is to ignore it, to be honest, because you don't want to get into a back and forth that could either trip you up and you might say the wrong thing, or it can lead to more misinformation. And there's no point because you're not really going to be able to persuade them, right? So so for example, we get a lot of this with Stop's work. A lot of tobacco company accounts will actually send messages or, create confusion in a lot of posts. And what we tend to do is just leave those alone.
And we have another question about regulation of social media. Is anyone regulating social media?
In terms of like the actual platforms, like
I think, yes, I think that's what the question.
Well, it depends on what you mean, because for example, on Facebook and Twitter, there are certain regulations, right? So you can't, let's say you can't advertise tobacco products. And a lot of times this affects advocates, because if you're posting something, a campaign, even though it's against tobacco products, it might be, the algorithm will pick it up. And so that's why a lot of times you might have difficulties in like getting your content flagged and things like that. So in that sense, there are regulations that you have to work around.
I think we faced that during the campaigns. Facebook was rejecting a lot of the posts just because they had the word tobacco in them, or so yeah, we did face that.
And a way to, this is an ongoing issue, but some tips there would be, like you said, using leaving those words out, but still using a message that kind of directs to that. So maybe not using the word tobacco, not using like actual cigarette imagery necessarily, but you can use, for example, let's say like a lung that has, tobacco related illness or something. So there are ways to get around that, but I think everyone faces that issue.
And we have a question from Rebecca. How do you create a social media that is going to resonate with your target audience?
In part, you answered this,
Yes.
Yaina. When you were asking what piece of it was most important, or what we wanted to know more about, that was the one that I felt like was important.
I think, yes, and that's the one that I would recommend taking the most time to do research and to develop, right? So a lot of it depends on your audience. So if you know that your audience, let's say, are advocates and policymakers, then the quick videos on TikTok are not going to work. You want to lead with more stats and what can be, a result if you do XYZ, as opposed to maybe the harms, because they kind of already know the harms of the issue, right? So it really requires a lot of research and understanding your audience. And then kind of going back to that slide I shared about messaging, I think for any audience, messages that evoke emotion are going to be more influential, right? When you have more of a human-centered focus whether it's for advocates or policymakers or the general public, it's going to resonate more than just a list of facts.
Thank you.
And we are short on time, unfortunately. I would like to really thank all of our speakers. Thank you, Yarni. Thank you, Lisa, Ashish, Rebecca, Nandita, Pallavi, and everyone. And I hope this was beneficial to our audience. I am going to send an email to everyone asking them if they would like to join the newsletter for Vital Strategies, which is honestly a very wonderful resource on tobacco. So I'll follow this up with an email, and I will be sharing the video, the recording of this webinar with everyone, as well as the slides if the speakers allow me. And again, thank you, and have a lovely night or rest of the day. Bye-bye.
Thank you so much, Rhonda. Thank you to the speakers.
Thank you, everyone.
Thank you.
For joining us.
Bye. Bye.
Bye-bye.
Thanks.
Bye.
Thank you, everyone. Bye-bye.